California in particular, the economy is codependent on immigrant labor, utterly dependent, either legal or not. We have about 10 million immigrants here in the state. If we're going to implement a system that excludes a chunk of people just based on the immigration status, that's just a bad public health policy, because you can't have a healthy community when you have that many people that are excluded from the system. So that's one. And then when you look at, luckily 2 of the versions, I believe, of the proposals going around do include reimbursement for those legal permanent residents that have been here less than 5 years. The initial proposals were to exclude them. The CHIP reauthorization for healthy families finally put them back in, because since up until last year they were a state-only, state-funded option. So I think again, as the Latino Coalition, that it's important to keep those lawfully residing children and pregnant women covered, and also adults, even under the 5-year bar. Then, as we look into the undocumented aspect of this issue, I mean, you take, for example, even the employer-based system or workers' comp. Workers' comp does not really cover everyone, and there is always a battle to get them kicked off the system. When you look at day laborers, for example, only 6% of them are actually able to claim anything if they have an injury at work. And the amount of work that we lose, or the economy loses every year because of injuries at work, is just outstanding. Then on a similar fashion, we have issues that are unique to California when you consider the migrant and seasonal labor force that go from one part of the state to another, or from one to even out of state to follow the crops. And that's something that we'd like to see addressed in these proposals. The portability issue, even some binational pilot that are occurring right now in California for people that work in San Diego and go back and forth each day, or every week. Those are policy issues that we need to tackle in a national reform. Again, and I think that when we see that half of the 12 million unauthorized migrants, according to the Pew Hispanic Center, do not have health insurance and don't have any access to health care. Again, goes back to my initial point that having that such a large chunk of the population not insured is a big problem. We realize that, given that health debate has already become such a big and toxic issue, adding immigration to it will, we recognize that would, it tank the whole thing. So we would like to see comprehensive immigration reform as the next major item that gets treated. But on the same time, many Republicans and some conservative Dems are insisting on, E-Verify systems, because they want to make sure that no unauthorized immigrant is going to be able to get health reform. And our position is that there's already systems in place. Even the Medicaid program right now started the DRA, citizenship proof requirements that are excluding people right now, because it's even hard for citizens sometimes to get that information readily. So we don't feel it's necessary to burden the system. We should be thinking about simplifying, get this implemented as soon as possible, and then let's deal with immigration comprehensive reform. If we want to tweak or improve E-Verify, let's do that as part of employment and as part of immigration reform. Let's not deal with it now.
I think that we do need to keep immigration reform separate from healthcare reform. Those are 2 separate issues, and both need to drastically occur. I think that unfortunately the undocumented follows the scapegoat for trying to halt all healthcare reform, and I think that's absolutely almost a crime when you consider that of the 46 million that are uninsured, only 7 of them are undocumented. Now, how does that affect our safety net system? We have to keep our safety net system in force and intact. Right now it is, but it's shaky. There are not enough resources going into the safety net system. Thank goodness we have foundations and grants who help support our nonprofit agencies to help take care of this problem. Without them, millions of people would get less care than they normally receive. The demand already is exceeding the supply. To think that healthcare reform would make the safety net system unneeded is untrue, because we would still need to take care of all of the undocumented, since they seem to be wanting to be eliminated from every single piece of healthcare reform. And I think we need to remember, folks, that heart disease, diabetes, AIDS, they don't ask whether your legal status when they come into your body. And when they do, and you're here, they're going to be in our emergency rooms, in our hospitals. Our hospitals are barely surviving. A lot of them are in the red. And if we think that these problems are going to be eliminated overnight, I think we're being unrealistic. We waited until this became a crisis. We saw this coming years ago, before the Clinton administration. To let it get to this status and then try to fix it, we have a long road to haul. And I think that I think our president and our leadership and our government, leadership is supposed to be visionary. And I think they need to start looking at the long-term aspects of everything that this healthcare reform plan can do, especially around preventative care. To get to, for example, osteoporosis, you need to educate 9 to 14-year-olds to have healthy bones, especially women. You're not going to see the benefit until they're 50, 60 years old. So yes, that's going to be way long-term, and none of you guys are going to be in office. But you know what? That's not the goal. The goal is, how are we going to make it better for the future? So we need to be more visionary, more proactive, and less reactive. And that's what our healthcare reform needs to look like.